incredibly busy. We know how hard these times have been on all of us and will be. So what advice can clinical psychologists offer to any of us struggling with separation, loneliness, work from home, and just about everything else? CNBC's Contessa Brewer with some answers.
Brooke White is an avid runner, a mom supervising remote learning for her kids, and a clinical psychologist. She says in the conversation about frontline workers, mental health professionals are being left out.
We are not exempt from the stress of this time. We are holding up the weight of an enormous amount. A huge percentage of people have had COVID. Many, many, many millions of more than that have had mental health issues.
The demand for help is so great. Online therapy site Talkspace has seen a 100% increase in new users since February. Brooke now sees 35 patients per week, a 40% increase to her pre-pandemic caseload. Her go-to prescription for anyone feeling anxiety? First, talk to someone, whether a friend, family, or professional, but don't sit alone with the stress. Exercise.
It helps with anxiety, with stress, with trauma, with depression. You know, it's one of the best tools we have for mild depression is exercise.
Get outside. Sunshine, fresh air, and nature work wonders. And practice mindfulness.
Moving in and out.
I asked her to show me.
Come back to your breath.
Do you practice what you preach?
Definitely. I would not be able to continue to do my work if I wasn't practicing what I'm preaching.
Well, speaking of preaching, prayer is another way of practicing mindfulness. And another recommendation here, help others. Reaching out to others to be a resource for them. You can volunteer in your community because it's hard to surrender to self-pity if you're not focusing on yourself.
Yeah, good
Jeff?
point. You know, so many therapists are now offering teletherapy. There must be challenges in that, though, right?
Yeah, they say there's a lot to learn here, but they say what you learn to do is read the signals differently. And in fact, they say it can be a big help for a lot of people. One, because they don't have to leave the office or home. And two, because they might feel much more comfortable in their familiar surroundings than in a therapist's office. And the research backs that up. It works.
Shepard Smith here. Thanks for watching CNBC on YouTube.